everyone, it's Julianne from the Chesapeake Center. Sorry for the delay. We had some technical difficulties, but we are now live. And thank you so much for joining us and spending your Sunday with us. I'm here today with Wendy Sharp, who is one of our therapists at the Chesapeake Center. She works with children and adolescents with anxiety. And so today we're diving into child anxiety, what to look for. So we know that the symptoms of anxiety look different in children. And so we're going to talk about some of those differences. We are going to go over a few things in the beginning, but please ask your comments or ask your questions in the comments. I'll follow along and hopefully we can get to all of your questions. So let me just introduce Wendy to you all. So Wendy Sharp, she is, again, a therapist at the Chesapeake Center. She's been in clinical practice for over 20 years, and she also works at the National Institutes of Health in ADHD research. She received her bachelor's at the University of Michigan and her master's in social work from Harvard University. So welcome, Wendy. Thanks so much for taking your Sunday with me.
Absolutely. I'm so happy to be here.
Yes. So let's dive right in. So I guess we'll start with, what are the different anxiety disorders in children and how can we recognize them?
Okay. First of all, let me talk about some statistics around anxiety. So the Center for Disease Control says about 70% of all 3 to 17-year-olds have an anxiety diagnosis. And yet the World Health Organization says about 32% of kids in that same age range have anxiety symptoms. So those numbers could be fairly staggering, but it also means that kids are being missed and lots of kids with anxiety are going undiagnosed. And when people think of anxiety, I think the most common anxiety disorder is generalized anxiety disorder that people think about. So these are the kids that worry way more than their peers, the kids that constantly ask sort of what if questions, right? What if I fail this test? What if my mom gets sick? What if a tornado hits the house? What if somebody breaks into the house? And, you know, these worries can be common in kids, especially young kids. But with generalized anxiety, they worry way more than their peers. They worry about their health, their family, their future events, past events. And when it really gets in the way of everyday functioning, for the child and the family, then we really call it sort of a disorder.
So what are some of, I know that sometimes the symptoms of anxiety can be more on the physical side.
Right, right, especially for young kids, right, who have a hard time finding the words to express what they're anxious about, right? So they may be kids that complain lots of headaches or stomach aches. And again, you know, there could be sort of a pattern to things. So parents actually making a diary and kind of keeping track of when kids are complaining about these physical symptoms can give you a clue as to what might be going on and what kids may be anxious about. But again, it's sort of excessive, ongoing, and uncontrollable worry. And people who are older, you know, kids in school age and adolescents could certainly mostly talk about those symptoms. And kids who are younger than that, again, it's a lot of times sort of irritability and clinginess, sometimes tantrums, and lots of physical complaints for some kids.
Fine. So we're just
okay. Sounds good. Sounds good.
But so thank you for that overview. I guess the one question I have is, what are the most common anxiety disorders in children?
Yeah, so certainly generalized anxiety, which is what I just talked about. These are kind of the what if kids. But there's also social anxiety, separation anxiety, and OCD. And I'd be happy to talk about those too. So in social anxiety, these are kids who have a huge fear about negative evaluation, right? About being rejected and judged by their peers, worrying that other kids might think they're stupid or other kids won't like them. And many time again, there's physical symptoms here too, like stomach aches, like feeling their hearts racing or maybe even sweating. And the emotion kids feel is sort of shame and embarrassment. And what they do to handle those very intense feelings is avoid, right? So many times they'll avoid raising their hands in class in case they get the answer wrong. They'll avoid wanting to go to school or wanting to go to camp or going to new places, and maybe even going to a friend's house. And again, for young kids, this could be sort of avoidance and refusal, but it also could be sort of freezing behavior, maybe whining and clinging behavior too. So that's sort of a capsule of social anxiety. For separation anxiety, you know, we all know kids when they're really, really young, 1 and 2, they want to be with their parents all the time and don't want to sort of leave them. And that's very appropriate and common. But when kids get to be school age, they should be able to separate from their parents and caregivers more easily. And you call it separation anxiety, and this is sort of in school age kids when there's excessive anxiety about being away from home and parents, worrying a lot that bad things are going to happen to their parents when they're not with them, or worried for themselves that they're going to get lost or they might get kidnapped. And again, many times this will just prevent is refusal. You know, I'm not going to go to school. I'm afraid to go to school because something might happen to you when I'm at school. Or I'm afraid to go to my friend's house because what happens if something happens to me and I get, you know, I get kidnapped or I get lost. Or kids will go to that friend's house but have to call and check in with their parents, you know, every 10 minutes, every 15 minutes. So that's separation anxiety.
Age would you say, since you mentioned that, of course, all kids, you know, at a younger age want to be with their parents.
Right,
do you see separation anxiety at a clinical level in younger ages? What age groups, you know, can you start to notice this?
Yeah, I mean, I think, again, once it becomes impairing and it's really age inappropriate. So I certainly wouldn't diagnose separation anxiety in a kid who's 1, 2, or 3, right? But once kids are school age, once kids are in kindergarten and are still showing that really strong attachment and excessive anxiety about separating from their parents or separating from their house and home environment, then I would really think about possibly a diagnosis or certainly an evaluation.
Other question is, you know, I even remember back when I was in school, and you know, we get this a lot at our center, is that first week of school back, or the first week back to school.
Yep.
Is that normal? You know?
Oh, I think that's very normal, right? For the first week of school or the second week of school, kids, you know, being hesitant about getting on that school bus or going into school. And probably what this fall would look like is joining the Zoom room for school, right? Very, very appropriate. But if it goes on for a month or more, if we're looking at the month of October and those same symptoms and problems are still there, then I think we're looking possibly at getting some help at that point.
So I guess, you know, a big question is, if parents are starting to see some of these symptoms,
right,
what can they do?
Right. So the big, the place to start, I think, which is probably most helpful, is to track it, right? Like many times I have parents in my office who talk about, you know, the kids are anxious, but can't give lots of details about when it happens and why it happens and what the triggers are and how long it's going on for and when the symptoms started. So I think the first place to really start is to keep track of, you know, when these symptoms happen, how frequently they are, and how upset the kids are. So that's sort of a first point. In terms of what parents can do, should we jump into that, Julianne, or should we? Yeah?
Yeah, absolutely. I think,
okay.
Absolutely. What can you do at home?
Okay,
what are the first steps, I guess, before you would seek professional help?
Yep. So I think the first step is to provide consistency and routine, right? We know kids really thrive on consistency and routine. In the world currently, that can be really hard to do, right? But any sort of routine, you know, in terms of a bedtime routine or after dinner, we always do this, can be really helpful for kids. And also, you know, kids are very sensitive to adults' anxiety. So for parents who have an anxiety disorder, or for parents, you know, who are just feeling anxious for the chaos that's happening in the world right now, just for parents to keep their own anxiety in check and recognize when they're anxious, and use some skills to reduce their own anxiety and possibly get help for themselves. So certainly parents keeping their anxiety in check. The other thing that I think is really important for parents to do is limiting media exposure, right? And this is not just during COVID, but this is in general, like young kids watching the news where there's war and there's talk about climate change and terrible things happening in the world. is tough for them to process. So certainly limiting media exposure would be helpful too.
Days,
it is hard to do. Yeah.
But
yeah.
The best that we can, it's true. We live in a day and age where, we have cell phones and we're just so overly exposed to such negative news. Not all news is positive. In fact, most of it is negative. So kind of limiting that, setting some boundaries, I think that's great. What do you think about in the moment of a child kind of in that anxiety moment? What is the best approach for a parent?
Sure. So first of all, some reassurance is obviously, important and important for parents to do. But then at that point, teaching kids the skills that they need to calm down. And there's many, many different ways to do that, right? So kids need to learn the words, especially young kids, right? When they start to develop all these physical symptoms, they might not have words for it. So they may need help with learning the word worry. And they need to learn skills with just how to settle, right? How to breathe. And there's, great.
I've lost you, Wendy. Can you hear us?
Properly, right? And it's diaphragmatic breathing. It's not breathing in your chest. There's also some great YouTube videos on meditation and relaxation for kids that are really short. That could be, kids as young as 4 could watch these. Maybe 5-minute videos that talk about meditation and deep breathing and relaxation. And those are really important skills to learn for anyone. The other thing is again, to help kids soothe, is sometimes parents and kids together could work to make calm down corners, right? A corner of their bedroom, a corner of the kitchen or the family room. I work with parents who had a little tent they set up, and the kid went inside the tent when they started to feel anxious, and they would listen to music or they would look at books that they would like. The kid liked lots of fidgets. So for this kid, it's a fidget spinner. For other kids, it may be Play-Doh to mush or putty or that sort of thing, so they can bring all the senses in and practice the meditation and the relaxation skills. There's also great videos on progressive muscle relaxation, because one thing that happens when we get anxious is that our muscles get really tense, right? And what could be very helpful is focusing on specific muscle groups in the body, tightening them up for 10 seconds and then relaxing. And there's really good videos on, pretend you're making lemonade and have lemons in your hand and you're squeezing really, really, really hard for 10 seconds and then letting go. Or pretend there's an elephant who's walking towards you and the elephant's about to step on your stomach, and you tighten those stomach muscles really, really tight for 10 seconds and then you let them go. And again, there's lots of YouTube videos on there that parents could practice with their kids on meditation and progressive muscle relaxation and breathing.
Definitely. I think breathing is
yes.
something we all need to do a little more of,
Yes.
And we'll share, Wendy, if you send me any of those videos, we can definitely share those resources. I think that would be wonderful just to.
Absolutely.
Even what you mentioned about like squeezing the lemons and different things, that's so much easier for a child to understand than like meditation.
Yes. Very true. Very true.
Practical tools. I also feel like parents these days, because we want our children to be so happy all the time, that when they start to feel anxiety or anxious or upset about a situation, our first instinct is to kind of like jump in and problem solve.
Yes, so absolutely.
Is that something parents should be kind of, how should parents address those without necessarily taking over the problem and letting the child kind of experience that?
Right. Well, first of all, like, kids need those skills, right? So initially sitting down with kids and practicing those skills together is useful. But what's not helpful is too much reassurance, right? And I think you're right that parents want to jump in and help and solve the problems. And it's really important that kids learn for themselves sort of how to breathe and how to settle. So certainly some reassurance is fine. But when kids come back to parents over and over and over and asking for reassurance, that's not helpful. And kids never learn the skills themselves with, how could I reassure myself? What could I think about now that will help me calm down? And those are crucial skills that we all need, I think, to rely on ourselves for moments in our lives when we feel anxious. But it's important, certainly, for parents to provide some reassurance, and certainly validation for those feelings is important too.
We actually had a question, and I guess this is just good to know. Are there any not necessarily well-known symptoms of anxiety in children? Like, for example, the question was, can sleepwalking be associated with anxiety?
Well, that's really interesting. And I think the answer is yes. Certainly the most common anxiety symptoms are difficulty sleeping, poor concentration, some muscle tightness, again, sort of the ruminating thoughts sometimes too. And for young kids, sometimes it's irritability, right? Sometimes it's not just overall feeling worried, but getting sort of really irritable. I have heard a handful of cases where kids have sleepwalk, particularly during times when they're anxious. At the beginning, there's one child I know at the beginning of every school year, actually, who has some sleepwalking behaviors. And once the anxiety from school sort of settles down, then the sleepwalking settles down too.
Very interesting.
Yeah.
So are there any other symptoms like that you haven't mentioned? Or I guess, again, it's just, anything that's kind of out of the ordinary, or
everything that's out of the ordinary. And I think parents sometimes understandably have a hard time distinguishing, what's in the realm of sort of normal and what's an anxiety disorder, so to speak. When do I seek help? And I think the point of seeking help is when there's impairment. There's impairment in sort of the daily functioning of a kid, right? When a kid becomes really unhappy or overwhelmed by their anxiety symptoms, or the kid may be fine, but the parent is spending so much time reassuring the kid that the parent is miserable. That can be a time to seek help as well.
And since you mentioned, even with the parents being anxious, I've gotten this question before. Is it possible, for your child to catch on to some of your anxiety symptoms if you're a parent? And, we had some concern about, I remember this one mother was asking, she has anxiety and like how she can prevent her child from having it.
Right. I mean, we know there's some, heritability to anxiety, right? It's certainly not as heritable as something like ADHD, but there's definitely a genetic nature to anxiety. Again, I think it's just parents sort of recognizing and focusing on their own symptoms of anxiety, right? So children are really good at picking up on when we're anxious, right? And it's okay to be anxious, certainly, and it's okay, I think, to express to our kids, I'm feeling kind of worried about this, but I'm going to be okay, and I have this under control, and here's what I'm going to do. And sometimes, some of that modeling, appropriately so, can be really helpful to kids too.
How can parents best provide validation? We know that's so important to validate the feeling. What are some of the terminology that you can use to kind of even explain feelings to children, or how do you help parents?
Right. So let me give an example, actually. There's a 5-year-old who was really, really, really irritable, probably for the first 2 months of school. And he had lots and lots of worry about, are kids going to like me? Am I going to have friends? I'm worried about leaving my mom, that sort of thing. But the only way he expressed that was just huge amount of irritability. As soon as he kept it together at school, he got home and was irritable for hours, right? And the parents had to really work on giving him language, right? That I think is what's happening for you at school, is that, this is a big change for you and that you have some worry. And that's okay. And we're going to, work on together of how to reduce your symptoms of worry. So sometimes they need language, right? They need to know, they have the feeling inside of them and don't know what to call that, right? And so and I like the term worry more than anxiety for kids of that age group.
Thank you. I think that's great. And so, at Chesapeake, for a certain age group, it's more parent coaching rather than therapy for the child. Obviously there's, right? So when you work with parents and children, are you helping them to develop that structure? What are some examples of how we can, especially now in this age, provide that structure and support?
Yeah. So certainly when young kids come to Chesapeake and their parents, it's working with everybody together, I think. And when kids are older and when they're teens, I'll work with kids individually. But again, it's providing some reassurance. It's providing language for how to talk about it. It's providing cues for kids with, sometimes it's a nonverbal cue that a parent can give a kid that, ooh, I think maybe, you're feeling a little anxious now, and the kid goes to the calm down corner. But it's working with everyone together on developing skills like progressive muscle relaxation and breathing, right, in order to sort of calm the agitation and irritability and muscle tightness and restlessness that kids are feeling inside. And when kids are older, certainly, teens could certainly, and older, elementary school age, could certainly do some individual work to help on anxiety symptoms as well. And the type of therapeutic modalities that are most helpful, I think, for anxiety are cognitive behavioral therapy and sometimes just strict behavior therapy. And depending how that goes and how somebody does, sometimes medication like an SSRI might be added in addition to therapy.
So did you say strict therapy?
Behavior therapy, like for some kids, it's cognitive behavioral therapy, CBT. And for some kids, I think it's just strict behavior therapy. For phobias, for example, just behavior therapy without the cognitive part could be really, really helpful. And that's just exposure is what that is. And for social anxiety, it could be exposure too, right? At a very small level, doing something that makes you a little uncomfortable, right? So with a phobia, for example, it would be if a child has a fear of snakes, right? It might start to be to look at some pictures of snakes or look at videos of snakes. And then, if they're feeling anxious, they do the breathing and do what they need to do. And then it may work up to, let's go to the zoo and visit snakes or see snakes. And it may progress to, let's go to somebody's house we know who has a snake and you can pet the snake. But you can translate that into really anything, right? You can translate that into if a child has a fear of raising their hand and answering a question in class, right? You work up to that. You work up onto answering a question in a small group when a teacher's working in a small group. Or the next step would be you answer a question maybe during gym where you feel more comfortable or during art. So again, it's sort of incremental steps, recognizing the anxiety you're feeling inside and doing the breathing or muscle relaxation to calm yourself. But it's behavior therapy and it's exposure is what's most efficacious.
Just building it little by little.
Exactly.
So, mentioning helping your child kind of settle and breathe, how do parents know when, obviously you're not a psychiatrist for the medication piece, but when you're working with a family, at what point might you mention medication when it gets...
Yeah, I think you're going to get different answers depending on who you talk to, right? So I'm a social worker, and I think, the best dose of medication is none, right? So if a child's struggling with anxiety and enough so that parents want to seek out therapy, I think it certainly would be fair to say, let's do therapy for 2 months. Let's do therapy for 3 months and see how much symptoms reduce. It may be that medication isn't necessary. If therapy doesn't cut it and the anxiety symptoms are still there, then I certainly think it's worth a conversation with a child's pediatrician, who then may refer to a child psychiatrist to provide medication.
Speaking of, the collaboration, do you work with the schools as well? Like, can parents work with teachers? How can they advocate for their child if they do have an
Absolutely. No, absolutely. So certainly I think it would be wise to share with teachers if a child is experiencing some anxiety in school, to talk with teachers. School counselors can be very, very helpful, and sometimes schools themselves will have groups, right? The school counselor will provide groups for kids with anxiety, and just talking to other kids and knowing you're not alone and other kids feel anxious too could be really helpful. Again, depending how extreme the anxiety is and how much is getting in the way, certainly there could be accommodations made at school for kids too, to manage anxiety symptoms.
I think that's great. Just to even know, there are these fantastic resources in the school, and to, have support all around. So it's not just one thing at home or,
Right. Right. There's also really some great books. There's some workbooks out there that parents can use to do sort of workbooks with their kids around anxiety symptoms. So there's two I want to mention, actually.
Please do.
The authors are Huber and Matthews. And the first one is called What to Do When You Worry Too Much. And it's a kid's guide to overcoming anxiety. And the other is What to Do When Your Brain Gets Stuck, which is a kid's guide to controlling OCD. And we didn't, maybe we could talk a little bit about OCD now. So OCD looks a little different than other anxiety disorders. And OCD is obsessive compulsive disorder, and it's kids, who, or anyone really who sort of ruminates about things, who gets stuck, right? They get stuck on the thought that somebody's going to get sick, or they made a mistake, or that something's unlucky and they have to do something to make it lucky again. Or, traditionally people think about OCD in terms of cleanliness and germs and all of that, but it could be a vast variety of ruminations or obsessions. And then what many times kids will do is sort of rituals, doing things repeatedly to make sure everything's going to be okay, right? So it could be lining things up in a certain way, or apologizing over and over. Or, I worked with a kid a while ago who needed a conversation to go to a certain way. So when a kid started ruminating about things, they needed to say something very specific to their parent, and they needed their parents to say something very specific back. So again, I think OCD is a little bit different than the other anxiety disorders, but it can be treated in the same way. Like certainly medication could be really helpful for OCD, as well as cognitive behavioral therapy too. And again, it's treated in the same way as that, you do something in little small steps that makes you uncomfortable. And then you manage
the too, that it's about being uncomfortable,
It is about being uncomfortable, and many times, understandably so, parents want their kids to be happy and not uncomfortable. But sometimes the best thing parents can do is to kind of leave their kids be and let them be uncomfortable and manage those symptoms, because stepping in too quickly doesn't give kids the ability and the time to develop those skills that they need.
Yes. So being able to sit with that discomfort and kind of get through it and realize that it's temporary.
Exactly. Yeah.
With OCD, is that something that you start to notice at a certain age, or that can be any age?
I think that could really be any age. I work with a kid as young as 5 who had, pretty clear-cut OCD. Many times it's harder to detect the symptoms, and kids sometimes could be quiet and not share what they're ruminating about. So again, it's parents playing detective and trying to figure out what's going on. But it's usually more apparent when kids are older. But again, I think the symptoms could still be there at a very early age too.
With separation anxiety. So I know I have a few friends with children who, have pretty severe separation anxiety, where they might not be able to, anytime that they leave the house or go out with friends, their child has a very severe reaction.
Right.
So what are some tips for parents? Obviously there might be a need for getting professionals involved and helping with that.
Right.
Are there ways to help? Is it the same thing where it's exposure? It's like a little bit of time?
I think it is. I do think it's exposure, right? It's a little bit at a time. So what sometimes parents do is say, oh, my child is so upset every time I go out, I'm just not going to go out, right? And that does not teach the kids the skills that they need. So it could really be parents, going out for half an hour and then coming back. And then building the time, right? Building the time so it's longer and longer that parents are away. Sometimes kids will call parents while they're gone, right? And, a parent's gone for 2 hours and the kid's calling 10 times during those 2 hours to check on them, right? So it's a discussion beforehand, again, starting in small increments, but not taking the calls from the kids, right? Not providing that reassurance over and over again, which the kid craves because they want the symptoms to go away. But what it's all about is the children developing the skills, right, to reduce the anxiety themselves without the parents stepping in and reassuring. But again, I think for most anxiety disorders, it's exposure, and it's just bit by bit doing something that makes you a little bit anxious, knowing you have success, and then moving to the next step.
Yes, I think that's great. And then also, even what you mentioned, having that conversation before you leave the house. So it's not uncertain that this is going to happen. It's going to be
right.
Okay.
And that we're, we're going to go out to dinner. It's now 6 o'clock. We'll be back by 8. And have a good evening, and we'll see you in a couple hours. And again, it's working really slowly. And for kids who have extreme separation anxiety, it really is parents leaving the house for 20 minutes. And the kid, practicing at that time, they're going in their cozy corner, they're doing breathing, maybe they're listening to music, and as soon as they know it, those 20 minutes are gone and their parents are back home.
That just made me think of another thing about
go ahead.
Debrief. And, for parents, when they come back, what are the conversations that they should have?
Yeah. I think it depends on what you walk into, right? If you walk into a 5-year-old who's on the floor in tears, right? That's kind of different than walking into a kid who's like, oh, wow, you're back already. And I think the reaction for kids can be anywhere in between, right? So again, for if you're walking into a kid who's on the floor in tears, it's like, oh, I'm sorry that was hard for you, but we're back and you got through it. And let's go move on and what's next in our day. And I think you could acknowledge certainly the kids' feelings, but I wouldn't fuss. I wouldn't get on the floor with them and lay next to them and, cuddle them for an hour and it's okay. I won't go out again. Right. That's not helpful.
That was great. Thank you for that. So I think also, parents nowadays are spending a lot of time at home.
Yes.
Probably noticing some more symptoms that they may have never noticed before, or it's just, again, this time in our lives. We have COVID, we have a pandemic going on. We're all sharing the same household. We can't really do the things we used to do.
Right.
What can parents do during this time during COVID?
In terms of sort of managing a child's anxiety?
Yes, because you would say anxiety, everyone has kind of anxiety, more worry than usual, right?
Very true. Very true. Again, I think it's paying attention to their own anxiety and their child's anxiety. I think it's not, depending on the age of the kid, it's really not having the news on and really not leaving your phone around and not discussing, right? Certainly I wouldn't have discussions about COVID or about global warming or, what's happening with sort of police presence in this country lately with young kids, right? And I think because, so many families, everybody's in the house all at the same time for hours and hours and hours, which is different, right? So it's getting space for parents, getting space for yourselves. And kids may need space too, right? There's siblings who are spending, zillions of hours together who normally may see each other, for a few hours on the weekend because one kid's in sports and one kid's in a play. So it's figuring out, right, for each person in the family to get their own individual space, I think it's helpful. Sometimes that's tough and tricky, but it can be helpful. And parents taking kids one-on-one, right? Like one parent's going to take out a kid, let's go for a walk and maybe walk down to the park, where the other parent stays at home if it's a 2-parent family and plays a board game with the kid. So it's sort of dividing and conquering in a way, but giving individual time and attention to each kid, as well as everyone being able to have the ability, if they can, to take time for themselves to regroup.
Awesome. Well, Wendy, I think those are all the questions that I had. And it doesn't look like we have any other questions in our comments right now, but for any of you who are watching this after the fact, if you want to go ahead and comment, we are monitoring and, we'll definitely respond the best that we can. I just want to thank you so much, Wendy, for spending your Sunday with me, talking about this topic that is so important for parents to understand and be able to recognize. Is there any last minute thoughts that you have?
A couple resources I want to mention. The American Academy of Child and Adolescent Psychiatry, ACAP, AACAP, has a great website for lots of different disorders, including all the anxiety disorders. It's a great resource for parents. And I also really like the Child Mind Institute, which really sort of lays out, what are the symptoms of anxiety, what to do, when to seek help. So that's I think, two great resources for kids and families.
Awesome. And we'll be sure to put that in the comments and definitely spread the word about those. Again, thank you, Wendy. And for those of you who are watching, please make sure, if you haven't already, to like and follow us, as we're doing a number of these Facebook Lives. We have one coming up on mindfulness and ADHD, and also one to help prepare parents for distance learning, which is becoming our new normal. So definitely tune in if you can, and have a great rest of your day.
Thank you.